Welcome back to the Mountain Morning Show. We are a small town here in Park City, but we are powerful when it comes to service unto others. So many great organizations that we're fortunate to feature here on MMS every week, with visits from those who have dedicated their time and their abilities to serving our community. And first among equals of all of the great organizations in this town is the People's Health Clinic. I'm excited to be joined by our pal and certainly a champion of the People's Health Clinic, Beth Armstrong. Good morning.
Good morning.
How are you?
I'm so good, thank you.
Good. Nice to have you here.
Thank you. It's great to be good to wake up and come in and see you. Not used to having you first thing in the morning.
True. It's a lot, I know.
Yeah. May need to have a cup of coffee after
this. Oh, Beth, you're so great. And what's new?
There's, the great news is that there's nothing really new. There's no issues. There's no problems. It's nice. I should knock on wood.
That's right.
It's really wonderful when things are just working. And right now at the clinic, things are working really well. We have Rochelle Flynn, who came to us a year ago. And since she arrived, whenever she started with us, she not only was, she started out as a volunteer, became a medical assistant, left us to go to school to become a PA, came back, is our PA and our clinic coordinator. And we are seeing currently, at this time, based on past years, more patients than we've ever seen.
Wow.
So we're helping more people. I think we're doing it better. We've tightened up some things and really just doing a lot of outreach. Patty Garcia is our outreach coordinator. She also does all of our, not only does she go out into the community, but she also does our resourcing, which means if someone needs to go and have more dental work done than we do in the clinic, then she'll find them a dentist. And if they need surgery, she finds them a surgeon. So she's a really key part of the service that we provide. And in concert with that, we work with Holy Cross Ministries, where we have now gotten, we have a promontora who is with us, and Lizette is her name. She's from Park City. She's a local, so whenever she's speaking to our clients, they just have a great connection with her, and she's doing an amazing job. If a mother's pregnant, about to give birth, she enrolls them in emergency Medicaid so that she walks them through it. She's doing a great job. So you should come and tour the clinic, meet the team, because no one's leaving, nothing new happening. It's just wonderful to just be able to sit and have it all work well. We do have with Jewish Family Services, just in respect of it being Mental Health Month, we have a mental health provider now, 2.5 days a week, who is Spanish speaking, which is she is actually an ESL, so she's a native Spanish speaker, and that makes such a difference whenever she's with patients who maybe don't speak English, and we don't have to have a translator in the room with them. So it makes a huge difference for the quality of service that we can provide.
And that's such an important part of our community, as I find, especially with the community orientation of the morning show here. Day after day, in a lovely way, we're talking more and more about our Latino neighbors, friends, family members here in Park City. Right. And so that linguistic ability to cross culturally, not just language, but culturally, is so important for our community.
We realize that whenever we offer services, we have to be respectful of everyone's culture.
Yes.
I tried to make the analogy a couple of days ago to a friend who was saying, well, why don't we just do it the same way we do it at the hospital or in Salt Lake? And I said, if you were in Guatemala and you needed to go to a doctor's office, you wouldn't know what to do. You wouldn't know how to speak the language. You wouldn't know what they were saying to you. If they were telling you, if you were trying to adjust your diet, You wouldn't understand what type of foods they were talking about or what the menus were or how to cook them. And when we stop and take that into consideration, you realize, you know what, it's different, and we have to sort of meet them where they are.
Well said, and it's interesting that the question that I wanted to ask, or kind of the topic that I wanted to raise, really you have been referring to throughout your comments, which I think is really fantastic, and that is that, and when I first came to town, I utilized the services of the People's Health Clinic, and I noticed then, and looking back now, you've alluded to how we do it at a hospital, or how folks do things in the realm of healthcare. It always has felt to me like the People's Health Clinic has a human touch and a concern in every person who's there. Every person who's there isn't just a caregiver, but also someone who cares. Right. And that is a somewhat unique thing in the field of healthcare.
Right. I will say that as a board member of Park City Hospital, they do it better there than any other hospital I've ever been to. But the reason I think it's a lot because we don't have as many rules. We don't take any federal funding. So there are things that we don't have to do. And we don't bill you. Because everyone, whenever we have at the hospital, whenever we ask people, we send out the questionnaires about their service, if you send it before they receive their bill, much higher markings than if you send it after they receive their bill, because there's always, there's being billed, having to pay that amount of money for services. It's difficult, and it makes you unhappy. So yes. Our patients are happier because we do ask them for a donation when they come in, and if they can pay it, something they will, and if they can't, they still see a very qualified physician or PA or nurse practitioner at the clinic, or any one of our other, highly qualified, licensed clinical social workers. We're so fortunate, first, to live in Park City, where Indeed. Everyone wants to be. So everybody tends to be happier here. You don't have people that live here and kind of drudge through life. We're all, excited to wake up in the morning to see what the day's going to bring us.
Well said.
I think that as a general rule, we're just happier here. And I think at the clinic, like I said, it's a family. We do our work. We're happy doing our work because we know we're doing good work. And there's no place I'd rather be.
That's fantastic.
Yeah.
I often think in conversations like this, and I think it's a lovely thing that you're able to say with enthusiasm, no issues, there's not a lot going on, and that's okay. That being said, the People's Health Clinic has been vital to this community and is changing in ways, has to change in ways that this community has changed and is going to continue to. Mm-hmm. If you would, talk a little bit about kind of your vision of the arc of where this facility and where the idea of the People's Health Clinic has been, where you are now, and what are your goals, I guess is not maybe a specifically applicable word, but what is the People's Health Clinic in 5 or 10 or 20 years?
So, our greatest hope is that there would be no need for the People's Health Clinic. We would love to be out of business. That would mean that everyone had health care. Until that happens, we're going to be right where we are, helping those who have no insurance in Summit and Wasatch County. We're so lucky to have Dr. Hanrahan, that has been from the very start involved with the clinic and is still our medical director and sees patients and is a vital part of the clinic. There are things that we would like to do, that there are more things that we'd like to offer. We would like to have more eye equipment so that whenever we have volunteer eye physicians come in, that they have all of the proper equipment. I tell people all the time, all we need are physicians and money, because with that, we could do anything. There are some clinical needs as far as equipment. I'd love a dental chair, but with a dental chair comes maintenance and supplies, and we have to have, a regular volunteering dentist. So if anybody out there has a dentist chair they want to donate to the clinic, we'd be happy to take that. Also, with the dentist chair, you need the plumbing and the floor. So there are a lot of things that we would, not to say that we can't do more and better, and we're trying to do that over time, but for the service that the clinic originally was for non-emergent care. And then now we offer things like the vision and like the dental, chiropractic care. We have an acupuncturist. We do mental health. So as it builds, so whenever it started in the early days, it was just to meet the needs of those people who had the chronic illnesses, the diabetes and prediabetes and hypertension, the prenatal, just making sure that there's so many in our community that come here and don't have the care from the moment that they find out they're pregnant until birth. And that's the one thing that we'd like to work really closely with Holy Cross Ministries. And hopefully they're one of the 3 finalists for the Women's Giving Fund grant. And their project is vital to the health of moms and babies. And I hope that all the women that vote out there will take notice of that project that they're putting forth for the grant, because it's important that parents or mothers have a place to go from very early on in their pregnancy, just the same as everyone that I know in all parts of the United States get. Again, it's a cultural thing. They, in the countries where they've come from, that's not typically the case. Therefore, they have lower birth rates and more issues with their pregnancy. So here we would like to make sure we actually have better outcomes when mothers see doctors earlier in the pregnancy. So that's what we're hoping for, and just that parent education. And we are doing more education in not just prenatal, but diabetes management, in nutrition. We do ask everyone the mental health questions, just doing a small mental health questionnaire just to ask, where are you and are you okay?
It's such a lovely buffet of services.
It's
quite incredible.
It is.
And so much of those accomplishments under your guidance and on behalf of everyone in the community. Thanks for that, Beth.
Oh, well, it's a team. We are definitely a team, and I'm just keeping the ball up that Nan got in the air, so.
Indeed. Well, it's lovely to see you as always. Thank you so much for making time early in the morning to join us.
Good to see you early.
It is. It's nice to be here, and I always look forward to seeing you again. Thanks for visiting.
Thanks so much.
We'll see you soon. Beth Armstrong of the People's Health Clinic, one of our very important institutions here in lovely Park City. We're going to take a break. We'll be right back. Lots more show continuing on right after this.